Good afternoon, St. Louis. Thank you for being with us here on a Wednesday afternoon on Inauguration Day. We've got just a couple of things to visit with you about today, and then, of course, we're going to take your questions. But let me just begin by saying Happy Inauguration Day to everybody. A new president sworn in the peaceful transfer of power that that we're accustomed to in our democracy, and I think that's a plus for all of us. So I just want to pause for a moment to say Happy Inauguration Day. Now, with that, we're going to talk about COVID today, and then I'll talk for a minute about the vaccine and vaccinations, more importantly, and then, of course, we'll take your questions. So, COVID cases are better across the region and across the state than they have been in a while. Now, I want to point out to you that we are coming off of 2 weekend days and a holiday, so not as much testing done and not as much reporting done on those days for testing. So, but yesterday on Tuesday, the Tuesday after the holiday, the city of St. Louis reported 39 cases. We think it's likely that that's a bit of an anomaly caused by the holiday because we had previously been running about 80, 90, even up to 100 cases a day. So we'll see what happens with that number over the rest of this week. But it is fair to say that cases are down from where they were, say, particularly in November and around Thanksgiving, that sort of time. So 39 new cases yesterday. Our 7-day average of new cases is 80 cases a day. So that's about 27 cases per 100,000 people. Now, if you compare that, the state is down also. The state's running at about, statewide, about 35 cases per 100,000 people per day. So that's a 7-day average of 2,100 cases for them. St. Louis County is running about 42 cases per 100,000 per day. Jefferson, Franklin, and St. Charles are down similarly. So that's good. I think that is not the time to let your guard down, though, because we've seen in the past how quickly that can turn around. So just keep doing what you're doing now, which is wearing a mask, social distancing, keeping your groups small, and being careful, because we know that this virus is extremely contagious, particularly with the new strains of the virus that are being discovered and tested really across the country. So while we are all waiting to get vaccinated, we got to continue to take these mitigation steps, which are working. Now, a couple of other numbers that you may be interested in. Number of people currently in the hospital, 716. Currently in the hospital with either COVID positive or suspected positive, 716. Of those people, we still have 141 people that are in the ICU with COVID. And of those people, we have 88 people that are on ventilators with COVID. And to be honest, the number of people on ventilators has really not gone down much since the 10th or so of January. So we're continuing, we are seeing the number of people in hospitals go down, but we are continuing to see that there are a number of people in ICU and on ventilators, so they are quite ill. The number of patients admitted to the hospital, and these numbers run 2 days behind generally. The number reported yesterday was that 80 people were admitted to the hospital. That's probably a number from Sunday. Fewer people usually admitted on the weekend than during the weekdays, because that's been running over 100 for quite a while. So the 7-day average number of patients admitted to the hospital is 97. And there were 107 people discharged from the hospital. So case counts are trending down. Number of people in the hospitals are going down as well. So that's excellent. Let me see here. Oh, the positivity rate, which, you know, that's the number of people who get a test. How many of those people, what percentage of those people who get the test are testing positive? And our rate's down at about 12% for the 14-day average rate, and even less than that in this past week for the 7-day average rate. When we think about how we're doing against the metrics that we've set, and this is all on our website, of course, but you know, we said that we'd take a look at lifting some of the mitigation strategies when we were down to having only 35 cases a day, and as I mentioned to you, we're averaging about 80 right now. When we had daily hospital admissions in the region of 40, and we are averaging daily hospital admissions, let's see, do I have that number? Yeah, I do, of 97, so nowhere close to 40. We said we wanted to see the hospital census down under 350, and we're still at 716. And we wanted to see a positivity rate of less than 5%. So our numbers are going down. We should feel good about that. We should keep doing what we're doing now, and hopefully continuing to do what we're doing now with the mitigation procedures, coming in with people being able to get the vaccine, which I'll talk about that in just a second. Hopefully those two are going to continue to drive our numbers down, and in the not too distant future, and I don't know what that is. I don't know if that's 2 months or 3 months or 6 weeks, but that perhaps we will meet some of those metrics that we're striving for. And I mention this because I think with this downturn in some of the numbers, I mean, this is the first time we've even been able to think about the fact that maybe we are headed in the not too distant future to meeting some of the metrics. We certainly all hope so. Now, with regard to the vaccine, a few people are, is really the way I should say that, getting vaccinated in St. Louis. We know that the VA has had some vaccines, and some people are going to the VA, if you're a veteran, of course, that they are available there. We also know that a lot of people, most of the people who work in our hospitals that are patient-facing, inpatient-facing jobs, most of those folks have at least had one vaccination right now. Many of them are getting their second vaccination. So that's a real big plus. It's going to be a very big help to our healthcare system and of course to all of us. So healthcare systems are getting vaccinated. VA is getting vaccinated. I think the federal court system in the not too distant futures, they will begin vaccinating some of their folks. The governor last week said that anybody over 65 is now eligible. In the city of St. Louis, that's a little over 40,000 people that are over 65. We also have about 60,000 people that are under the age of 18. So that's 100,000 people in total, using some round numbers here. That leaves 200,000 people in the city of St. Louis that are between the ages of 18 and 64. And of those 200,000 people, the state estimates that, actually this was the pandemic task force, excuse me, they have estimated that probably around 20% of those people, so another 40,000 people, would have serious underlying health conditions which would qualify them. So the long and the short of talking about all these numbers is that there are in the state of Missouri almost 2.5 million people that are now eligible to receive the vaccine. Now, to put this in a little perspective for you, the state says that they are receiving about 80,000 doses per week. So not nearly enough yet, but we are hopeful that this will begin ramping up. I just read before I stood up here that Amazon has reached out to the new Biden administration and said, hey, maybe we can help you with some of the logistics. I know that many other companies are also helping with those logistics, but this is a very big job. City of St. Louis, I have been on the phone with Dr. Randall Williams a couple of times today and yesterday, and so we are in line to get some vaccine pretty soon. Don't have a firm date yet on that, but it just is a difficult logistical problem, and we're all trying to work through it. Everybody wants the vaccine. I shouldn't say everybody wants the vaccine, but you know, we're looking at least about 60% of the people want the vaccine, and it's different in various age groups. So now, just like we had when we first started testing, you know, the logistics of this are not easy, but over the next few weeks, we expect for the vaccine to become more available. So that's where we are on vaccines. If you have not already signed up to get information, the City of St. Louis has a site where you can sign up. It's really a sign up to get information about when you might become eligible. We've had about 23,000 people sign up so far. In addition to that, I know the major hospital systems, BJC, Mercy, SSM, also have sign-up systems, and that is to be able to sign up to get in line when your time comes, when your turn comes, to be able to get the vaccine. So recommend that you sign up. Sign up for on as many websites as you want, but only take one appointment, please. If you get to the point where you're able to get an appointment, don't book double appointments. That will really you know, confuse the system, and you know, then you would be if you got the vaccine in one place, you'd be a no-show in another place, and that means you've kept somebody else who could have gotten that dose. So that's what we know about vaccines and COVID right now. Do we have questions?
A couple of questions. So generally speaking, does the city have an estimated idea when it's receiving vaccine, how much it's getting, and how it will be distributed to the community?
Well, as I just said, we don't know exactly when. We expect to get some vaccine within the next few days, or at least within the next week. So we hope that will occur. As you probably know, St. Louis County, which has 1 million people, has gotten about 4.9 thousand doses, so not very many. Not nearly enough for what they need. But the other thing that we have in the city of St. Louis is we have the federally qualified health centers, and they are also receiving some vaccine. Not enough. As of yesterday afternoon, they had only received 195 doses. But it's going to continue to come. So no, we don't know how many doses we'll get per week or on what schedule we'll get it, but all those logistics are being worked out. It comes from the federal government down to the state to Pfizer and Moderna right now, and then to the distribution points.
We've had a couple of questions, one from Al, speaking to the vaccination of first responders and when they fall in line, and how the city will make sure that EMS, EMT, police get vaccinated.
EMS, EMT, police, fire, corrections are our first priority as soon as the city gets vaccine. We're also working with some partners to make some of that happen as well. That's just beginning.
We had a couple of folks asking about the lights downtown for the COVID memorial. Doug, Kendra, Sharon, Michelle all want to thank the city of St. Louis for lighting up portions of downtown last night.
Well, that's nice, Doug, Kendra, Michelle, and Sharon. Thank you for that. You know, it was a nationwide effort. Cities across the country lit up the buildings that they could, amber, in response to the 400,000 lives lost to COVID. And we changed the filters on the federal, on the civil courts building to amber last night. I don't know if you saw our post. The building looked beautiful. We also, in downtown, there are the lights, the street lights that have a band on the arm that goes out to the street light that's able to be turned different colors, and those were turned amber as well. I don't think it came through as well in our pictures, but in person, it was really beautiful. And we really appreciate it's downtown STL and the business partners, the LHM, the Cardinals, so many businesses who have stepped up to put that new lighting in downtown. It looked really good. So.
You talked about the new variant of COVID that's popped up in this country. Wade's question is, do we know if COVID tests and COVID vaccines are detecting the new variant and working against the new variant?
You know, that's all being studied right now. So I hesitate to give that's a medical answer or lab answer, but from what I've read, some of the testing is being done to detect the new variants, and there's more than one, as you no doubt know. And they believe that the vaccine will be effective, but that hasn't actually been studied yet, or that information is not final yet.
Michelle, another Michelle's question has to do with returning to Blues and Cardinals games. Do we know when more fans will be allowed to go back to Busch Stadium and Enterprise Center?
We don't know right now, Michelle. You know, that's kind of why I went through some of the metrics with you, if we can continue to bring these numbers down. You know, we are working with them regularly, and you probably know that I think there were 350 people that attended the Blues game yesterday, day before yesterday. But of course that's not enough, but you know, we've got to bring the numbers down before we're going to be able to put a lot of people together in one space. So we want to do that as badly as you do.
One of the first items the new president says he's doing is a national mask mandate.
Mm-hmm.
Are you supportive, and do you think it'll make a difference in the St. Louis region? Oh,
of course I'm supportive. We've had a mask mandate in place in the city of St. Louis since July 3rd, I think was the date. And I do think it makes a difference, frankly. I think we've not only had the mandate. Having the mandate doesn't make the difference. Getting the compliance makes the difference. And we've had good compliance in the city of St. Louis. And I think that's why throughout the last 6-7 months, our numbers have been better than many of the counties in the surrounding area. So it's about wearing the mask, not the mandate, that helps. So the more compliance we can get, the better.
Kelly asks that you remind people that COVID-19 is not your typical seasonal flu, and asks, are you worried about people not following the restrictions because more people are getting vaccinated?
Sure. That's why we really, this is about education. COVID-19 certainly is not the seasonal flu. In the city of St. Louis, we have had 337 St. Louis residents die of COVID-19 across the country. As you know, we've had 400,000 people die of COVID-19. So it's certainly very, very serious, particularly for older people or people with underlying health conditions. And I think, you know, people are tired of this. I get it. We're fatigued. We want to socialize. We want to be with our friends. We're tired of wearing the mask, but it's not that big of a deal to wear a mask. And so, you know, we're just trying to persuade people to keep up the good work and continue to follow the mitigation strategies, wearing a mask, socially distancing, washing your hands, etc.
And I think our last new question so far is, when the city does receive vaccines, do we get to determine how many doses we receive?
Not really. We've ordered 5,000 doses. That would vaccinate our firefighters, police officers, corrections officers, and some additional. So people who work in our morgue, etc. So, but we don't know if we're going to get 5,000 doses. Bear in mind, the county hasn't even gotten 5,000 doses yet. So, you know, no doubt everybody needs it. There's 114 counties in Missouri. They all need it. And so no, we don't get to determine that.
That is it for new questions today, Matt.
That's it. You guys went easy on me today. It's only been about 20 minutes. Thank you for being with us, and we'll be back and talk with you in a few days. Thanks. Bye-bye.